Hi, we're Roy and Karen, and this video is about Medicare supplemental plans versus Advantage plans.
This is such a great topic because we have just gone through the differences in these plans for ourselves personally over this last year. But before we get into it, let's understand something. When we talk about supplemental plans, there's another word for it, Medigap, and that was the term we'd always heard. So if we use these terms, just remember they're
Interchangeable.
They're interchangeable. They're exactly the same. We're also going to be talking about the difference between a zero premium Advantage plan versus Supplemental Plan G. And the reason we're picking those two things is because they are the two most popular plans out there in the whole country. Zero Premium Advantage and Supplemental Plan G. Premiums. That's one of the big differences. When you have a zero premium Advantage plan, well, it's just that. You have no premium. And even in some cases, they might give you a rebate against the premium you have to pay to Medicare. When you get a Supplemental Plan G, depending on where you are in the country, your premium can be anywhere from $100 to $300 at the time that we're recording this video.
Based on your location, based on the plan, based on a few different factors.
When we were in Texas, that plan N that I was on was going to be a lot less money than if I signed up in Florida. It was a big difference. In either case, doesn't matter if you pick an Advantage or a supplement, you're still going to have to pay the Medicare Part B premium, which as of this recording right now, 2025, I think it's like $185. And if you're on Social Security, they're going to take that out of your check immediately before you ever see it. Other coverages. If you get a supplement, if you get Medigap, it just covers whatever Medicare covers. If Medicare covers it, you're covered.
Right.
But
it's medical only.
Correct. And it's only what Medicare covers. If you get an Advantage plan, well, mine comes with dental and drugs and vision and
hearing.
What'd you say? And that can add up to a bunch of money. Also, perks. You're not going to get any perks with your Medigap. But with Advantage, depending on what company, depending on what policy, you could get a gym membership. So I get to join the Genesis
Health
gym that's in Brownwood, and I get to go there. Depending on your policy, they may cover you for the transportation costs to get to and from your doctor, and you'll get reimbursed. And we get a quarterly allowance to buy over-the-counter products like aspirins or knee braces or cough drops.
Yeah, it's not cosmetics, it's not candy or although I think chocolate might be a medical necessity.
And red wine. And I wish those things were covered because they give us like $150 a quarter, and we have a tough time spending that. I mean, there's only so many Band-Aids you need.
and Sensodyne toothpaste.
You only brush your teeth so many times a day.
And when you reach a year's supply, you're kind of done, yeah.
You're kind of done. But those are the kind of things you're not going to get in the Medigap plan. Now, what are the costs beyond the premium that you would have in an Advantage plan? Well, you're going to have co-pays and co-insurance, and all of that varies company to company, policy to policy. But you will have a max out of pocket. And from what I understand, the average for max out-of-pockets around the country is about $5,000. But for my policy, it's $2,400. Well, I've never had an insurance policy with a max out-of-pocket that low before. With Medigap, with the Supplemental Plan G, you're going to have a $257 deductible.
Annual deductible.
And then once you pay the deductible, and I'm going to read this because I want to make sure I say this exactly correct. Once you pay the deductible, the rest of your Medicare approved medical care is covered at 100%. But let's compare. Let's just take our yearly cost for the Plan G and our yearly cost
For Medicare Advantage.
and let's understand that this is if we hit the max out-of-pocket. For the Medigap, you're going to have a premium. And I told you, it's between $100 and $300. Let's just say it's $150. 12 months, you're at $1,800. But you're going to need dental. Well, that's $50 a month. Now you're at $600 for the year. And you're going to need a drug plan, probably around $10 a month. That's $120. And if you happen to need vision, that's another couple of $100 a year. That's $2,720. And you're going to pay that whether you have any other expenses. That doesn't take into consideration deductibles or copays or anything. That's just what you're going to pay. For our Advantage plan, well, our max out-of-pocket's $2,400. And that's only if I had to use it to that level. I haven't in the past year. Maybe it's cost me a couple of $100. My dental insurance that I had when I was on Medigap, it only covered me for $2,000 a year.
And it costs you $600 to be able to get the $2,000 per year.
And with my Advantage plan, I've got $5,000 worth of dental. For some people, managed care is something they're just never going to do. And we understand it because we've been in HMOs before.
Right.
And at some points in time, it's been
some sort of claim declined, and you're like, what the heck? I'm not making this stuff up. I need what they're recommending.
Which brings me to network and out of network. The reason that we initially had me going on the Medigap, the supplemental plan, was because we had heard that if you went on an Advantage plan, it's centered on where you live. And our plan was to do a lot of traveling. And we wanted to make sure we had medical care access 100% wherever we went. And we understood if we went with the supplement, that's what we would have. And to a certain degree, this is accurate. Your Advantage plan is based on where you live and your doctor, and it's kind of an HMO, and yeah. But the fine nuance of this is, if you have an accident, if it's an emergency, it doesn't matter where you are in the country, it's considered in network. Well, I didn't hear about that before.
And then we found out one additional thing, that depending on which plan you select in the Advantage plan, you can contact them and say, hey, I'm going to be in Iowa for the month of July, and I need to make sure I'm covered there because I have to go in for my quarterly heart checkup or whatever it is. And they will continue to cover you if you take those steps. And then wherever you are, you would still have to find a medical professional that accepts your policy. So it's a little bit of extra layers, but for zero premium.
Administration. And what I mean by administration is, how easy is it to use your policy? This is a big deal. And the reason I say it's a big deal is because when I was on Medigap, even though I wasn't, it felt as if I was being nickeled and dimed to death. It always seemed like I owed somebody money for something. And ever since I went on Advantage, nobody asked me for anything. Now, we did talk about when you are on a managed care policy, you can be denied. And we've gone through that in our lives. We've been on HMOs, and whatever health care we needed was denied, and we had to go to administration, and we had to fight to get it approved. I just read this prior to making this video. I'm going to read it to you. A 2021 study found that of all prior approval requests, 6% were denied. Now, that may sound like a big number. You know, there's millions and millions of people on these kind of policies. 6% is a lot of people. 82% of those denials were overturned and approved on appeal.
It could just be a simple fix, and they fix them when you submit it, and they review it, and then you're done. Is it a pain in the neck while you're waiting and you're worried and you want to get something handled?
But knowing that if I am denied, I can appeal it, and 82% odds is pretty good. With Medigap, if Medicare approves it,
Done.
you're done. But I really wanted to know if I had a major expense. Let's just say I was going to the hospital and it's a $75,000 procedure. What would it cost me if I only had Medicare, if I had an Advantage plan, and I had Medigap? What would the cost be to me? What would be my out-of-pocket? It took a lot of homework to figure it out, but here's what it is. If you're on Medicare only, you're going to have your deductibles to pay, and you're going to have co-insurance, and it's pretty steep. On a $75,000 bill, and it really depends on what you're having done, but the minimum out-of-pocket is going to be $15,000. That's what I calculated. If you're on a supplemental plan G, you're going to have your premium, you're going to have your deductible, which is like $257 right now, and you're going to pay about $2,000. Not bad, not $15,000.
No.
If you had an Advantage plan, well, that's where my max out of pocket kicks in. The most it's going to cost me is $2,400.
If you've not used any throughout the year up until that point and you hit something big like that, $2,400, poof, done.
But it isn't a one-size-fits-all proposition, because do you have that kind of HMO aversion? Do you have a stigma to that? I just don't want to deal with that. Let me go on the plan G and know that if Medicare pays it, it's covered.
Just go find my care provider that's approved, and off I go.
But there are a lot of nuances to this. And when we had to make a decision, we just didn't feel comfortable with the information that we had. And we went to Medicare seminars.
It brought people in through church, and we've watched a ton of YouTube videos to gather information.
And still, we just didn't feel 100%. So we contacted C.ANDRUS, and I'm going to put her contact information here. I'm going to put it in a comment that I'm going to pin to the top, and I'll put it in the show notes.
And she's a reputable local insurance broker who came recommended by personal acquaintances of ours, several. And after we talked to them and then talked to her, then we met. So go through the steps to make yourself comfortable, but now, get the information if you need it.
She was able to simplify the process, and she was able to answer our questions and then help us with recommendations based on our specific circumstances
and priorities, because it might just be a personal preference and a personal need that isn't what everybody else has.
And keep in mind, I'm retired but old enough to get onto Medicare. Karen's retired but not old enough to get on Medicare. And so our circumstances are very, very different. But we need to make sure that our costs were in line with what we were getting from Social Security. And that's part of what made us uncomfortable. And Crystal made us feel really comfortable. It was very, very good. We highly recommend her. Maybe you don't qualify for Medicare yet, but you need medical insurance. We made a video on that exact topic. And I'm going to link to that video right here. But in the meantime,
We appreciate you stopping by.
see ya.